So my name is Dr. Claire Roddie. I work at University College in London, and I was the global chief investigator of the FELIX study. The purpose of the FELIX study was to investigate obecabtagene autoleucel, or obe-cel, in adult patients with relapsed or refractory acute lymphoblastic leukemia. And I think we're in a very fortunate position where the FELIX trial was very successful. So what we showed was that patients were able to tolerate obe-cel really well. The toxicity profile was really minimal. That's even despite patients being older with comorbidities or patients with lots of disease. Furthermore, lots of our patient population responded at month 1. And the really sort of interesting thing about this drug is the fact that around 40% of our patients remained in remission without any further therapy at just under 3 years. So obe-cel really, it has the capacity to deliver long-term durable remissions in a proportion of these treated patients. Of course, that data has really sort of changed the landscape in adult acute lymphoblastic leukemia. And soon after the trial read out, the FDA approved obe-cel in the US, and in November 2025, actually NICE approved obe-cel for use in the UK. So now we're really excited as a set of UK leukemia clinicians, and of course our patients are very excited to be able to have access to obe-cel on the NHS right now. And at the minute, the licensing is really around relapsed and refractory disease. So that's patients who failed other therapies. But I think the future is really exciting for obe-cel because what we recognize is that there's the potential to treat patients earlier in their disease course, maybe when they've been exposed to less chemotherapy and radiotherapy. The T cells that we manufacture, the CAR T cells from, have the potential to be fitter and more active. So we're sort of looking at earlier use of obe-cel in ALL, potentially as a sort of a future direction for this drug. There's trials that are being conducted at the minute in the US looking at this as an option for patients, and we're very excited to see this read out. I think the other thing that's really interesting about obe-cel and what we've learned from the FELIX data is the fact that the CAR T cells surviving in the bloodstream, or what we call persistence, seems to be pretty important for long-term durable responses. And it's important for us to develop a biomarker or an assay, a lab test that we can do to test CAR T cell marking in our patient bloodstreams. And we've been working with the companies to try and develop assays that we'll be able to access as UK clinicians to help guide what we do with patients following obe-cel infusion. So in summary, it's, we're all really excited to have access to this new CAR T cell option for adult ALL, particularly because it seems to be so well tolerated and it has this lovely capacity for durable long-term responses in a proportion of our patients. Yeah, this is really a sort of a turning point for UK ALL.